One of the major takeaways from the Ministry of Health press conference on Saturday is that COVID-19 can do serious damage to the lungs and kidneys of patients. While most people experience a mild form of the virus, in others, including people with no known illnesses, it can attack those organs, resulting in death. And with the local death toll already over 60, younger victims are emerging. 6 months into the pandemic, doctors worldwide aren't just treating the recently infected. They are starting to notice some patients are struggling to completely shake off the virus.
Growing numbers are finding that they haven't simply snapped back into their pre-COVID lives. Instead, after what may have been only a mild initial illness, they are experiencing a range of troubling and sometimes disabling symptoms: breathlessness, cough, palpitations, exercise intolerance, mental and physical exhaustion, anxiety, depression, fatigue, inability to concentrate, and brain fog.
2 weeks ago, the medical journal, the BMJ, hosted a discussion on so-called long COVID, since an emerging trend is that for some patients, the virus, while initially mild, can linger on. And since local patient experience seems to be mirroring what has been observed internationally, a question had to be asked.
Have you been experiencing patients lately or finding patients locally who have been experiencing acute long COVID symptoms, and how has that actually manifested in patients in Trinidad and Tobago?
In short, the response seemed to be there have been 1 or 2 anecdotal cases, but in general, the numbers are too small to identify a pattern as yet.
That we are still compiling information on whether people have lingering symptoms. So while we haven't seen that occur very commonly, you may have an anecdotal case here or there. As time wears on, we are compiling more and more evidence or information on what that presentation may look like in our population.
There is some evidence of lingering respiratory problems, especially the development of acute respiratory disease syndrome, which has a high mortality rate. And local doctors are also starting to observe cases where the virus is causing inflammation of the heart.
Is that if people who had COVID, they go back out into heavy athletic training, there is a chance they could die of something called sudden death, sudden cardiac death.
Again, while most patients recover fully, he says post-COVID-19 patients should check in with their doctors, especially when they notice changes to their health. And while doctors locally and internationally are continuing to monitor the evolution of COVID-19, the advice to the public remains to observe the public health protocols in an effort to limit their risk of infection in the first place. Soini Gray, CNC3 News.